Hello, guys. Hi, everyone. This is Syed from Oneness Education Foundation. We are right now starting our second episode on the Voice of Oneness. And for this season, we are focusing on advance and empower. And for this call, we have my amazing friend, and she's amazing human being, and she is Medha Saraiya. The intention behind this podcast is that we help the internationally educated healthcare professional by giving the right resources, by bringing in the successful people who gone through this process, who are the IEHP, and that's the whole purpose of doing this podcast. And yeah, with that, thank you, Ms. Medha Saraiya, for being here. And to start the podcast, over to you. Just a little bit of introduction about yourself, and yeah, for you to introduce to the audience. Thank you.
Thank you so much, Syed. Hi, everyone. My name is Medha Saraiya. I am a nurse by profession, but before that, I'm an immigrant as well. I moved to the country about 20 plus years ago now. That being said, this is not the first country I've lived in after leaving my home country. This is the second one. So in total, I've been out of my home country longer than I've been in my home country, if I put it in age. I have had the pleasure of working, as I said, in North America in a couple, like between US and Canada. So I've seen both the industries. People underestimate when you make a career change, people think, oh my God, how can I do it later in life? What is the impact? Well, like today, start. If you want to pivot, start. So I can say that my original degree was in art. I'm a painter by profession. But unfortunately, selling painting doesn't pay bills.
I
That
didn't
was a
know about that. This is what I'm saying. I can never do justice introducing someone like you, just framing in couple of sentences. No, that's not your identity. Your journey is completely unique, Miss Mehta. I'm excited to learn more about your journey. Yeah, please go ahead. Sorry for interrupting.
no worries. So I started in art, realized painting doesn't pay money. So I ended up doing graphic designing and web development when we had the internet boom.
Hmm.
Uh, Somehow, I don't know how, from web development to and designing, I landed up being a data analyst and worked for in a pharmaceutical company as a data analyst for quite a while before moving to Canada, where I had to start from scratch.
So this was in US then. So
Yeah,
you trying out the graphic designing at analyst in US. Okay.
yeah.
Right.
And when I came to Canada, I had to start from scratch. And the most interesting part in my career journey has been I worked for a pharmaceutical company in US. They had their branch in Canada, and I applied to for that position. It was a lateral move in Canada. And I went for the interview, and the first thing they asked me is, "What's my Canadian experience?" I
Okay.
worked at the same position in US. I could not. I was just surprised at the irony of it, like the irony of it.
I think
And
it's just a natural for them to ask that. No, it's just a natural the way they always talk about. We always talk about the winter. We being in Canada right now, we talk about climate. It's natural to start the any interview with. Do you have a Canadian experience?
I, I guess so. To me, it was just like it's the same company. It's a lateral move. Why are you asking for, like, in a way, shouldn't I almost be an internal transfer at this point? But anyway, so moral of the story is I had to start from fresh. So I had to go back and start from the basics. And in 2008, I decided, actually, I didn't decide, somebody decided for me because that was the big recession.
Mhm.
And the job I had, unfortunately, I was laid off. So it was decided for me that I was going to start my second career. And that's when I went into nursing. Now, with nursing, I've had utmost pleasure where I've worked in every nursing industry you can think of. Like I
Okay,
worked
can
with,
I start with one simple question between that? If you can just tell me how old were you when you're thinking to start your new education, not just pivot in the career, right?
I went back to school after being a mother of two kids at 33.
Now you are tempting me, Miss Mehta. I am right now 33. I am thinking about pivoting and trying something new. Amazing. Being a mother of two and moving to a new country during recession, still having that perseverance to yeah, start a new course. Great.
Yeah.
God bless you. Yes, please.
It was, it is challenging, but it's rewarding as well. And more than anything else, to me personally, I'm telling my kids that there is no age that you can't start over. I'm being the role model. So to me, that was
Mhm.
very important. Instead of being stuck in a job that wasn't rewarding, changing was a very pivotal moment for me because, again, as I said, being a role model for my kids. So now even my kids know that you can do what you want.
Yeah. That freedom, something that actually I'm learning from this conversation, the way you say, right? That's something that I should think about giving that kind of freedom to the kid for them to know about themselves and learn about what is their passion, everything. Kudos to you. Bravo. Yes.
The way I look at it, our next generation learns not by what we say, but by what we do. So, us being the role model is extremely important, just not telling them, hey, do this and don't do that. If I were to
Mhm.
say to my kids that you have the freedom to do whatever you want, it's like, how shall I say, I'm preaching without any experience.
Yes.
But
To
they
walk the
see,
talk.
yeah, when they
Yeah.
see it, I don't have to even preach them, then they see it.
Yeah. How was the experience going back to the college compared to studying back home? How do you think that the difference of education compared to the Asian
I
subcontinent?
personally thrived in the Canadian, US and both US and Canadian education system.
Did you
And
study in US?
I did do my graphic design and development and all that there. I did study, I went to school here. So
Yeah.
I would say I thrived in both of these settings because the expectation is a little different. My back home is India, and the expectation there was you almost have to memorize and regurgitate.
Mm, mm, mm,
And
mm,
I'm
mm.
not that kind of person. I'm the kind of person who I need to understand concepts.
Yeah.
Once I understand concepts, I can reword them, explain them in my way. That's the
That's what
only
they
way
want, paraphrasing. Yes.
yeah, I can do paraphrase, but I can't regurgitate. I can't tell you. So I'm not that kind of person. So for me, I thrived in this environment.
Yeah.
Was it a lot of work? Yes, because I was
Mm.
working part time. I had two kids under the age of 4,
At that time. Oh my God. Yeah.
and I was running a household and going to full time school. So it is, but
Yeah.
at the end of the day, rewards are worth it.
Two questions I wanted to ask here. One thing would be, would you say that your verbatim experience of memorizing stuff according to our the way we study, that did that help you in scoring or learning better? Because at the end of the day, healthcare is more about you still memorize a lot of stuff in anatomy and physiology.
I would say yes and no, because especially with anatomy and physiology, the
Mm.
understanding what helped me really a lot was understanding how systems
Yeah.
work, or
Yeah.
not also
Physiology at
understanding
least, yeah,
how
for sure.
system works, understanding how systems work with each other. And that I think was extremely important because that was what set me apart from a lot of my peers. Was like many people were just, yes, there is memorization, I'm not going to deny that, especially for
Yeah.
pharmacology, like you have to memorize
Yeah.
drug names.
For sure. Yes.
You don't have a choice, but some of it, understanding precedes. Once you understand something, you don't need to memorize it because you understand it.
Understood. Understood. Yeah, makes sense. Yeah, yeah. At least you are able to most of the memorization aspect, making into more practical and understanding aspect for sure. Yeah. The second thing what I wanted to ask is about yeah, running a family and taking care of two kids, doing the part-time job. I would say almost these things most of the parents do, juggling lot of stuff. But studying is something that's totally unique in a way. Uh, was it challenging? Was there a day that it was completely breaking you down? Because I want to still talk the realistic aspect. How were you able to do that? Because you must have did the diploma couple of year course. How was the journey?
So I actually had to do more than a couple of years. So when I did my RPN, it was more than 2 years, and then after that, I ended up doing my BHA as well. So that was another 4 years. But when I landed up
Right.
doing my RPN, I
Yeah.
because I hadn't done grade 12 math and science. So the
Yeah.
requirements Canadian schools are you have to have grade 12 math and science and English. Um,
Yeah.
I got the English waived, but the math and science, and it has to be done within 7 years
Mm, mm,
because I passed
mm.
my high school a decade
Ages. Yeah,
long.
for sure. Yeah.
So I had to redo grade 12 math and science. So that took it added 8 more months to my education.
To have the guts to actually go back and mention sites, I don't know if I could do that. It needs the guts, right? To think that we can do that.
In a way, in the hindsight, I'm glad I did it because now I
Yeah,
have kids in high school and I'm able to help
yeah,
them. So if I wouldn't have done it,
yeah.
so
Understood.
like it
Mm,
was a blessing in disguise.
yeah.
To answer your question, yes, there were times when gets to you. It's frustrating. It is a
Mm,
lot. Like I
mm,
remember times when I would get 3 hours of sleep because I used
mm,
to work at 5 a.m., 5 to
yeah,
1, and then on weekends also I used to work 5 to 8, 1 a.m. And then on
mm,
weekdays I had to be at, depending on my clinical, sometimes clinicals start at 6:30 a.m.
yeah.
You have to be at the hospital. So you
Mm,
basically, I used to work anywhere between school and work. It was my day that only was about 12 hours. And then you have the
mm,
kids and their stuff to do. So there is sacrifice. And another sacrifice that came my way was when after graduating, when I worked in the hospital, you work shifts. So
okay.
sometimes
Yeah.
you end up missing the first things like your first recital or your first, because you're at work. So there is sacrifice, but then there
Yeah.
is reward
Mm,
too, because right now, as I said, now that my kids are older, I'm a lot older, I can see the effect of the hard work.
yeah. So the sacrifice is not only you, so it's like a whole family has to sacrifice. Each and your kids, your family, all of us has to sacrifice. Yeah.
Everybody has to sacrifice, and there has to be an understanding, right? And there has to be an
Mm.
understanding that you're doing this for a reason.
Do you communicate this thing? Do you say that it will be good to sit and talk with your family, or is it like it's because we are not vocal about certain things from where we are from? It's just implied that we as a family has to do those things. So how did you manage? Was there a different way of thinking?
Actually, there was a lot of communication, there was a lot of collaboration, right? It also is
Mm, mm,
collaboration. It's about you may need a favor from a friend to pick up your kids because you can't make it, or you may
mm,
need a favor from your in laws or anyone, any of your extended network. There
yeah.
has to be collaboration, and it's not a one way street. You're doing something for me, so in return, I'm going to be doing something for you.
Okay.
He wants to feel like they're being taken advantage of.
Yes. Yes.
So
Yeah.
it's a collaboration on many levels. At the same time, it is those conversations are important because if you're deciding to go back to school, it's not only going to take toll as in with time and responsibilities, but it's also going to take a financial toll.
Yeah.
Going to school is not
Totally true.
cheap.
Yes.
So, what is the financial toll? Are you going to be able to sustain it? How are you going to be able to sustain it? There are
Mm,
resources available, there are loans available, there are grants available.
mm.
All that are you going to be able to manage? That is, those are conversations that you really need to have. And also, I always tell now that I teach, I tell my students you have to weigh out the pros and cons.
Makes
Is
sense.
this
So
not also, is it the profession that you really want to be in? Are you willing to sacrifice all this?
it also looks like that there needs to be a community involved. And is it like a consciously we think about getting close with your neighbors or your when you go to drop your kid in school? Do you talk to the other parents and see how we can support each other? Is it like a conscious communication, a conscious effort that you must take to be a part of community?
There's conscious and unconscious, right? We all have our own community if we are willing to rely on it. Like for
Yeah.
some of us, we may be able to bring our parents over, our in laws over who can help. Then that's a
Mhm.
huge benefit.
Yeah.
For some, it is relying on your neighbors and your friends. Again, I know people I have when I was in nursing school, I had the advantage of working with many single moms who
Mm,
figured it
mm.
out. They were in school full time, they figured it out. They would rely on their friends, they
100%.
would rely on,
Mm.
they had an understanding with daycare saying, hey, I'm good, can you do me this favor? And what can I do in return? There is
Mm.
always like,
Actually asking that out loud. Okay.
yeah,
Yeah.
and sometimes you just have to ask. There is,
Mm.
again, I tell this to my students all the time. If you don't ask, the answer is always a no.
Mm. Mm.
If you ask, the
But you're
answer, yes.
willing to actually ask that what I can do in return. That's what gonna make the conversation open and respectful instead of just asking, "Can you do this for me?"
No, and that's why I said initially, it's always a two-way street. You can't always
Mm,
take,
mm,
you've got to
mm.
give.
Yeah. Because right now, bringing in the family or in-laws with the current inflation and the expenses of flight ticket, and so it's been challenging. When I talk to people, it's been challenging for people to bring in the family here. At the same time, I'm just talking it out loud in a way. Few of them they're just so adamant on saying that I can't bring my family, I can't bring my in-laws. So because of that, I'm not able to step up. So would you tell them that if that is something challenging, that we have to get out of the comfort zone and talk to the neighbors or talk to the daycare and talk to the school?
Here's the thing, when people give you those excuses, they're
Yeah.
choosing not to choose. As human beings, we always have a choice. It's up to you what you choose. If you're putting those barriers up, it's like me saying, I can't go. It's minus 17 degrees today. It's too cold. I can't go out.
Mm,
I can't do this.
mm,
I'm choosing that. I can either bundle up, I can layer up,
yeah.
I can go out because life is going on around us,
It's
right?
a, yeah. So do you mean to say in a way that once people realize what is the consequence by not choosing not prioritizing the right stuff, trying to understand that. Yeah,
I'm
please
going
go
to
ahead.
give you a cliche. We
Mm,
reap what we sow. I
mm,
know it's a very cliche, but it's true.
yeah,
If you are not
yeah,
planting something today, how will you reap it? Today is Makar Sankranti, Lori, all that is going
mm,
on right
mm,
now, which is
yeah,
a celebration to reap.
mm,
But if you plant
mm,
anything, for me, it's the same thing, right? If you are not, you keep complaining that you want to change, but if you're not doing anything to make that change happen, and we all are very good at saying, "Oh God, please help me. I don't like this anymore. Changes." What to do if we don't do anything?
yeah. So until and unless we change our circumstance, God will not change our circumstance. Yeah,
No, God is there to help us. Whatever universe, God, whatever you want to call that, it's there.
yeah, yeah,
But for
yeah.
that, first, we need to change. We need to change our mindset. We need to change.
Mm,
And whatever barriers we are putting, like in a way, we are putting it on ourselves.
okay.
There's an old saying, I've heard my mom say it, I'm sure half of India has heard this, that if you
Mm,
really want to study, you'll study under the street light.
mm, 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 mm.
If you
Right.
really want something, like the way I say it, if you really want something, you will make it happen. And that's just the way life is.
Mm,
How much do you want it? It's up on to you. And that's a decision individually every human being has to make.
makes sense. Okay, sure. And I think we have ended the discussion about your journey, where you have completed the RPN. And you said you did some bachelor's also, right? After that?
So I'd landed up after RPN, I could have done RN, but instead of RN,
Yeah.
I landed up doing bachelor's in healthcare administration.
4-year course.
Yeah.
Interesting thought process. What made you to move towards administration compared to
Because I
RN?
knew by the time I'd finished RPN, I knew our bedside nursing wasn't for me. And skills wise, all the skills I had to learn, I already had knew. Like even
Mm,
when I finished my RPN, I was doing dialysis. I'm trying
mm,
dialysis cares. I
mm,
could
mm,
do
mm,
chemos.
mm, mm,
Only thing
mm.
I couldn't work as an RPN was in emerge or ICU, and I had no intentions of working in either of the two departments.
Makes sense. Yeah.
So I was like, okay, do I want to spend more time doing learning the skills that I already know?
Yeah.
Do I want to learn something new that'll help me in my future?
Okay. And how you came into that conclusion other than knowing that you don't want to do RN? But after RPN, pivoting to administration instead of going more towards clinical or more towards doing some of the specialization for the RPN? How you came into that conclusion to go towards administration?
So I was lucky enough so when I was doing my RPN program, we had 300 students in the batch that I was in. Out of 300 students, only 4 students got placements in hospitals, and I was lucky enough to be one of them.
Okay.
And out of the 4, I was the only one who was given a job as a student nurse. So I started working in the hospital even before I got my license. I was
Good.
working on a temp license.
Mm,
And when during my time in the hospital, I realized that I would not thrive in that environment. Like, I love nursing,
mm, mm.
but I'm not a bedside nurse. They're two different things.
Okay. Yeah.
And I
So,
learned that.
that's another thing. No, what's the two other thing? One thing is that you being RPN beside the patient, That's another thing I want to talk about after this topic, but you're already, yeah. What would you say? What do you mean when you say there's a two different kind of nursing?
We all have this notion that once you do certain profession, these are the only ways. I call them the herd mentality because we see everyone going that way. We only think, I'll
Mhm.
simplify that. As Syed, I teach at a few colleges, and when
Yeah.
students come in, the first thing they say, "Oh, I have to look for a part-time job, so I'm going to go to Tim Hortons or
Yes.
Walmart
Yes.
and get a
Mm.
part-time job there." And I'm like,
Yes.
that's a herd mentality because everyone else is doing it.
Yeah.
So that same herd mentality applies to when you're finishing nursing. Most
Yeah.
nurses say, I want to work in a hospital. Hospital is just one setting where nurses are needed.
Yes. Mm.
Nurses
Mm.
are needed in the community. Nurses are needed in specialty. Like I used to be a quality improvement nurse for a pharmaceutical company. Many areas. Somebody told me earlier today, I was in another meeting, and somebody said, there's a difference between loving what you do and knowing whether you're right fit for it or not.
You were saying you might love something, but you may not be fit for that.
So I love nursing. I loved, I in a way got a lot of kick with bedside nursing, especially adrenaline when you're calling a code and all that.
Mm.
But I
Mm.
wasn't a fit for it. So knowing when to
Mm.
step away, knowing what lane is right for you is a very important thing. Like I'm sure you would
Mm.
relate to it. When you went to med school, you had many opportunities to do many things.
Yeah.
Why
Yeah.
did you choose the faculty you chose?
Yes. Yeah.
That's a
Yeah.
lane that you
We
chose.
have prioritized certain things over other things.
Yeah.
Yeah. Mm.
And to me, that
Yeah.
was very important. And another thing was yes, hospital work was great, but the price I was paying for it, right? Not being there for my kids' recitals, not being there for sometimes even missing their birthdays because I had to work a shift. Like, what is your level of comfort with that? Like, I have colleagues who I've known for 20 plus years who have been working in the hospital. They love, like, I have this one colleague that I know. She's been working an oncology unit for 24 years and she only works nights for 24 years. And she loves it. I'm like,
Yeah.
it works
Amazing.
for her.
Amazing.
It doesn't work for me.
Yeah. Mm. I couldn't do it for 3 years. After med school, I was doing a night shift. 3 years, and I'm like, no, it's not my cup of tea. Yeah.
So knowing what your cup of tea is and knowing what you are,
Mm.
right? For me, bedside was good, but it wasn't challenging enough.
Mm. Mm. Mm.
That's how
Mm.
I went into administrator because that gives me
Mm.
another set of challenges that I
Mhm.
thrive.
Because what I'm not able to comprehend is that to decide to study, right? That's something that for some reason it's been frowned upon in this generation. I'm pretty sure you understand what I'm trying to say. That it's different for me itself. You having your odds, then to the graphic designing, then to RPN, then to bachelor's still, and I genuinely wants to learn that what kind of mentality you had, and how it gave you that commitment. Were you able to clearly see the career goal is going to actually add value? How you were able to jump onto that?
For me, my career goals are very different, right? And again,
Yeah.
your career goals change as you, for me, I can say this now that I'm older, as I age, my career goals changed.
Mm,
Just to put
mm,
it out
mm,
there, I'm still in school, I'm still learning. I just finished a session.
mm,
I'm doing learning EFT now,
mm,
alternative medicines.
mm, mm, mm.
And the idea for the reason why I'm doing it is to help palliative patient with pain management with alternative therapies besides opioids. So I'm still
Cool.
learning.
Yeah. Yeah.
But
Yeah.
the reason why I do it is okay, so when I was let go, I was already in healthcare for about 15 years by the time in
Mm,
2008 when I had to pivot.
mm,
So I knew
mm,
I wanted to be in healthcare. Now I could have chosen to be a dental assistant, I could have chosen many things.
yeah.
But at
Yeah.
that point,
Mm.
nursing made the most sense because it was the most flexible profession.
Yes, you're right on that for sure. Yeah.
So I was like, okay, let's go into nursing. Went into nursing, did a year of bedside, realized bedside wasn't for me.
Mm, mm,
So
mm,
then what? So I started working as a middle management for a pharmaceutical company. And I was like,
mm,
okay, this is where I'm thriving. So if I'm
mm,
thriving in more of a management role, then I need to do courses that are more of healthcare and management.
mm. Now I can see it. Yeah. Mm.
So that's why I landed up doing healthcare administration. Then
Yeah, I can
that's
see that's completely. Please go ahead.
that helped me with growing my business. So it's
I
there is
wanted to ask about that. Yeah.
yeah, so there is
Mm,
a transition on how things happen.
mm,
And one of the things I've learned in, I wouldn't say easily, but change is the only constant. That's one of the things I've learned.
mm,
And the
mm,
problem is many of us are fighting change, but that's the only constant.
we like it or not, change is going to happen, especially in this nation. It's going to happen.
In
We are going to
any
be thrown out around here and there. Yeah.
in any nation in the world right now, right? Like in
Yeah.
my lifetime, I have been where I've used rotary phones to black and white TVs
Mm,
to now watching entire series on this little device.
yes.
So
Yes.
changes are happening all the time.
Yeah. So as you said that we shouldn't be there in the herd mentality, you walk that path as what you were saying, right? So you are not in the herd mentality. You are making sure that you take a different route and accept the change. And yeah, that's amazing. Now, here the next thing would be you just now said about the business. Now let's hear about that. What made you to think about starting your entrepreneurship journey? I always follow your LinkedIn page. Even when we talk about how we can collaborate in terms of helping the healthcare professional in Canada as partnering with your organization, I could always see the passion towards. And the end goal is it will directly benefit the healthcare professional, also the patients. I would like to know more about what made you to start your entrepreneurship journey.
So in a way, I was entrepreneurial from very young age. I always had a business mind, and I always was like the way I always was trying to figure out how can we do things better. And that got really triggered when I was working in the community as a PSW supervisor, where I
Mhm,
had about anywhere between 160 to 200 PSWs reporting into me.
mhm,
And what I realized is the agency I worked for, they were charging the client X number of dollars.
mhm,
The PSW who was working that hour with that client was making not even quarter of what the company was charging. So I was like, this is a huge disparity. And I put myself in that position. If I was to get PSW services for my parents, would
yeah,
I be able to afford and sustain it? Because it's not cheap.
yeah,
And yes, the government covers a bit, but the government just covers, let's say, God forbid, if you have somebody who's quadriplegic, the government may give you maybe maximum $25 hours a week, which is nothing. So you need to find help the rest of the time.
yeah,
And if I have to sustain that, I'm sitting there and going, how? So the main reason for the portal that I'm developing is to connect healthcare users with healthcare providers directly. And the more equitable for both parties involved, where clients pay lower
mhm,
and PSWs can earn more because they decide their own schedule, their own rates, so they can earn more. So that was the main idea. Since then, we've pivoted a lot. We do a lot of education and training now. We are also looking at a navigation system. So we are pivoting, we are growing.
mm. Why education in a way that just because the opportunity was there to support your healthcare professional, or is there any history behind that that you felt that?
So there was a history behind that. A lot of the PSW programs, especially during the pandemic, a lot of private career colleges started doing PSW programs, and they were graduating PSWs in less than 6 months.
Yeah.
And unfortunately, in 6 months, you can only learn so much. There are knowledge gaps now.
Mhm.
And many of these PSWs, unfortunately, are paying for the knowledge gap because now that the economy is settled down a bit, they're having hard time finding employment. The idea being is giving them these micro credentials to learn specific skills.
Yeah, that
So,
will help them to step up and serve the right community. Yeah, makes sense. Okay,
so that's the
that's
idea of
good
came by.
for the education. Yeah. How do you think that the current labor market in this country? I'm obviously we pivoted from the discussion on what's the different ways for nursing. I think we should still get back to covering that. So before going that, how would you say that current labor market is? In which way would you say that the course what you are offering or the job portal which you have, in which way people can leverage that? If you can just give us a short intro about what you do, so people who are watching this podcast, right, they'll be able to reach out to you.
So one of the things they can, so our company, we are in the middle of rebranding our company. Our company is going to be called Vivirion, the new one. And
Okay.
in by May, we'll have our portal released. So where you can set up your own profile. In the meanwhile, we do have our courses available right now for those who are interested. Sayed, I can send you the email and you can share it with your group,
Yeah.
and they
Okay.
can
Yeah.
email me directly and we can go from there. So where I see the job market going, the job
Mm,
market is there is a need for healthcare. There's no two ways
mm,
about it. It's about where do you see yourself? What I mean is, if you are very keen on just living in downtown Toronto, then your job market is going to be much more competitive because there are too many people there who are equally
mm.
qualified.
Yes.
But if
Yes.
you're willing to travel and go outside GTA, then your job market opens up drastically.
Totally. Yeah. Makes sense. Yeah.
So there
Mm,
is that part of it. With regards to growth, the career is such that if you're an internationally trained nurse or an internationally trained physician,
yeah.
you are able to work as a PSW in Canada right now.
Mm,
But I always tell people don't get stuck in that profession. Remember what you came here for, what your career goals are. There
yeah.
are ways of getting your certifications and degrees approved. If
Approved. Yeah.
not, there are other ways of doing that too. Share a story. I have had a friend who moved to Canada 25 years ago. She was a physician from back home. She cleared all her exams here, but when it came to residency, at that point they were making everyone redo residency. When
Mm,
residency, they were asking her to move to north of Thunder Bay, in the middle of nowhere. And she was like, okay, this is just, she was newly married then. She's like, this is just not going to fit my lifestyle. So instead
mm,
of doing that, she ended up becoming a nutritionist and dietitian. She ended up doing another course, becoming a nutritionist and
mm,
dietitian, and she's thriving in her practice now.
mm.
So what I'm saying is, again, figure out what works for you. Not everything will work for everyone,
Okay.
but there are opportunities out there if you're willing to work towards it.
But how do you get that information as such that yeah, there are other options for me to do? Is there a place that where we can go and talk about this career update for us to do in a way, or is something that we have to search on our own?
There are organizations like what you have, Oneness, who, when you had your summit in
Yeah.
December,
Yes.
a lot of faculties
Focused
came.
on this.
Yeah,
Yeah.
that was your focus, right? So there are
Mm,
opportunities like that, and I'm sure when someone reaches out to you, you'll be able to guide them to where to go.
yeah. Yeah.
That's one option. Another option is find what you want to do. Let's say you are a dentist, but you want to start as a dental hygienist. Find a
Mm,
hygienist that you can talk to
mm,
and
mm.
find out what did they do? How did they get there?
Yeah. Yeah.
Here's the thing,
Yes.
again, going back, if you don't ask, the answer is always no.
We know, yeah. Yeah. At least talk to people. Makes sense. Makes sense.
Talk to people,
Now on this,
what you
yeah.
learn.
So on this, in a way that people always talk about jobs. Okay, and you said that you are connecting the client directly with the patients in a way, healthcare professional directly to the client. How is it going so far for you? Is there a way that is there a more opportunity at your organization for people to enroll? Is it like a part time or is it like a full time opportunity? How does this work?
So for our portal, we were successful. The reason why we had to come stop it because of some technical issues. So when we are
Mhm,
rebuilding the portal, somebody sets up their profile, they
mhm.
have to obviously give some kind of documentation because we want to verify all our care providers.
Yes.
Once the verification is done, they set up their portal like their own web page. They decide what area they want to work
Mhm,
in, how far do
mhm,
they want to travel, what are their hours, and what are the rates that they are willing to, like, what is their hourly rate. So
mhm,
we give them complete flexibility. There is nothing, unlike an agency, I'm not going to say you're going to work 7 to 3 shift, but in that 7 to 3, I will tell you which clients. You may not have all 7 to 3, but you're going to give me that
mhm,
availability and you can't do anything else.
mhm,
That's not the idea here. Idea here is to give you complete flexibility. So if you
mhm,
want to work from, let's say you have young kids the way I did, and you
mhm.
only want to work after you drop them off and before you pick them up between 8 and 2,
Yeah.
that's a choice you
Yeah.
make. We
Beautiful.
give
Yeah.
complete flexibility. Only thing is, again, because it's this is a gig economy, I'm not going to put it any other way. Just like any other gig
Mm.
economy, you're going to get what you put in.
So it's like a side hustle for the healthcare professionals.
And
Yeah.
that's the whole idea, right? Many healthcare professionals in Canada will have more than one job. That's just the
Mm.
reality. So this is your side hustle. Some people make it into a full time because, especially for young mothers with young kids, they want the flexibility. So they only do this kind of a thing because then they can have the flexibility that they want. And
Makes sense.
that was the whole idea,
Amazing.
right? Was to give.
Yeah.
Unfortunately, when I first started in the field, there was no
Yeah.
flexibility.
Makes sense. Then how would you say that? Is it only for the nursing background professionals or even with the BSc science?
As a BSc Science, you can work as a PSW. You need to
Okay.
have proper, like mainstream healthcare. So you need to have BSCN or
Mm-hmm.
physician, like MD, in order to work.
Mm. Okay.
If
Makes
you
sense. Yeah.
are a physiotherapist, depending on the area you are in and depending on the client, they may or may
Yeah.
not accept you.
So
So
client
there
can
are,
decide it.
see, here's the thing, right? Because this is
Yeah.
private, the clients get to decide a lot. Like
Makes
I've
sense.
had clients who've had hired internationally trained physiotherapists because physiotherapy here is not cheap.
Yes. Very expensive. Yeah. Mm.
And they want, so what they do is they have a physiotherapist that they see once a week and they take this
Yeah.
assistant with them who can learn
Like
the
a home
exercise,
visit kind of stuff.
and
Mm.
then they help them day to day. So it's almost
This is
like
the
the physio.
interesting thing. So nice.
Yeah,
Understood. So
it's work as
nursing
a delegated task
is
then.
yours. Mm, 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 mm.
So a physiotherapist is
So to be frank,
delegated.
they are getting more than PSW. So the same PTA works as a PSW also, but they also do the modalities and help the patient to rehabilitate. Amazing. That's a good learning. Yeah, nice. Yeah.
So it just depends on what, again, how much are you willing to put yourself out there, right? It's very
Mm, mm,
individual.
mm, mm. Fine, amazing. So if would you say that we are talking about what are the different nursing field? I think so. After that, we moved on to the entrepreneurship journey. In the last couple of minutes, if you can focus on that aspect. One you said as a bedside nursing, then it opens up the lot of opportunity. Right? That I always talk to my students saying that if you are a nurse, it doesn't make sense that you don't get the license here. Get the license, then you choose what you want to do. There are surplus amount of opportunity.
So once you get your license here, you can work,
Yeah.
as I said, in bedside, which is bedside can
Yeah.
be, again, bedside also changes. You can work bedside
Mhm.
in acute care, which is hospital. You can work
Mhm.
bedside in long-term care.
Mm.
You
Mm.
can work as not bedside, but more of a low middle management in a retirement home. You can work in the community as a visiting nurse. You can work in any of, I know a lot of pharmaceutical companies will hire nurses.
Understood.
There are a lot of
So this
nurses
is
who
only
start.
for the clinical role you are saying. Yeah, till now you are just covering the clinical role alone, actually being in
Yeah.
touch with patient.
Yep, there are
Yeah.
pharmaceutical companies that will hire. There are injection
Mm.
places that hire nurses.
Mm. Mm.
I know nurses that only specialize in PD and work for PD clinics. There are very specific clinical, there is a variety of clinical roles. Now, if you're looking at non clinical, you're looking at administrative. You're looking at a lot of more, all the directors of cares and all long-term care homes are nurses, which is management role.
Yeah,
You're looking,
totally. Yeah.
I know personally know of nurses who have landed up becoming lawyers and specializing in only healthcare law.
Okay. Yeah,
I know
amazing. This is
nurses who
great.
landed up
Yeah.
doing their MCAT and becoming doctors, and they are one of the best doctors I've worked with.
Yesterday I was talking to one student that to do a DDS or to do MD, at the end of the day, you need a bachelor's. So even right now, you taking a nursing down the lane, if you want to jump on and becoming a doctor, you can still do it. Yesterday I was talking about this. I'm glad that you were stressing
It's
this.
funny
Yeah.
you're talking about it to me because my daughter is applying to her universities, and her goal is to be an MD, and she's
Yeah.
actually applying for undergrad in nursing and as a pharmacist, pharmacology.
That is going to help directly for her medical journey. Being a good pharmacist is certainly going to be beneficial. Amazing. That's a bold step to take because pharmacy itself is a professional like dentistry and medicine. It's challenging field for pharmacists. Now they recently updated that instead of bachelor of pharmacy, they are moving towards a doctorate, doctor of pharmacy. like a Form D, how we have back home. Makes sense. But what is the actual difference between the practical nursing and nursing?
So when you look at RPN, you're asking between RPN and RN. Is that the question?
Yes. Yes, sorry. RPN and RN. Yes.
RPN is a 2 year college diploma. You can, in Canada, in Ontario, you can only do RPNs from government accredited colleges. So that was Sheridan, George Brown. You can't do
Mm-hmm.
RPN at private career college.
Mm-hmm.
When you get your RPN, just like RN, you have to write your CNO license. So NCLEX, and you have to get a CNO license. And just like an RN, you have to pay. It, they just bump their fees, $410 a year to keep your license. Things don't change. The scope of practice is where RN and RPN. So the depth of knowledge, right? If you think about it, RPN, if this is an iceberg, RPN is going somewhere midway. RN is going to the base. But the skills wise, what an RPN learns and what an RN learns is not that different. Well, it's very interesting in skills wise. So the role of RPN also has been growing. In the time
The
that
scope
I've
of
been,
practice.
the scope has grown drastically. When I first
Mm.
graduated, RPNs couldn't do chemos. Now they can. When I first graduated, RPNs couldn't put in an IV cath, but now they can.
Okay.
The
Right.
scope has dr- drastically changed. So what I'm saying is the skills you learn almost the same skills. Knowledge is where the difference happens. That's why even today, RPNs are not allowed to work in ICU, PECU, or Emerge. Generally, most of those will be RN specific roles.
Makes sense. And what's the process of becoming from RPN and RN? Is it just a 1 year degree or 2 year degree? How does this work?
So the way, if let's say your journey can start at the PSW to RPN, you can do a bridging course and then go into
Mm-hmm.
RP, which is 2 years.
Mm-hmm.
After RPN to RN, there's a 1 year bridging course, and then you have to do 2 years of RN. So for people who come from internationally, I always tell them if you are starting from scratch, like you have no knowledge and you want to start from scratch, I always tell them start at RPN. Yes, at the end of the day, you can do your RN in 4 years, your RPN in five. Like RPN to RN will take you 5 years in total and 4 years straight. But in
So two
those,
plus one plus two. Yeah.
yeah, but in those
Mm.
5 years, you are able to get, after 2 years, you're able to start working. Whereas here
Makes
for
sense.
4 years, you will not be able to work.
Yes. You're at least in the healthcare.
You're in the healthcare,
Yeah.
but plus anything else, if you're like me who realizes 2 years in, yes, I love healthcare, but I
Mm.
don't love bedside,
Mm.
is
Mm.
RN
What's
now
the
my
point
dream?
of studying for 4 years? Yeah.
Yeah,
Mm.
there are pros and
Yeah.
cons, right? So for me,
Yeah.
I would say RPN to RN makes more sense, for me at least,
Yeah.
but
Yeah.
then it's
Yeah.
very
Yeah.
individual too.
For me, in a way of PR journey also, we being an RPN, then getting the PR, then it's easier for you to afford for the RN also. So that would be a better option if you actually, as you said, badly want to be in the actually a bedside or in the clinical aspect of it. If not, certainly, as you said, we can jump around and be an educator or
And you know what? Also, as an RN, there are RN also opens up a lot more doors, right? Because from RN, then you can do another 2 year program where you can get Masters of Nursing, MSCN.
yeah,
I believe it's two or three. Don't quote me on it. No, it's
yeah,
3 year program. 3 years you can get Masters of MSCN plus nurse practitioner combined. And as nurse practitioners today earn a lot of money and they're
yes.
very highly needed. They're very much in demand.
As close as yeah. I don't want to quote it, but it's really good in a way that they can actually give a consultation and provide a treatment for certain disorders
Yeah,
also.
the scope
Yeah,
of practice, if I can, I'm going to say it, it's very close to being a family doctor.
you said it. Yes. Yeah.
It's
Yeah.
very close. And the scope of practice is changing every day, especially with the doctor shortages we are having. The scope of
Yeah.
practice is
Yeah.
just going to keep getting bigger and bigger.
Yes. Yes. Totally. Yeah. Makes sense. Now, how do you say that regarding entrepreneurship journey for the this would be a last question maybe how it helped you in terms of you achieving your career goals or life goals and do you suggest that something that people have to just take a risk once they actually have a passion towards entrepreneurship journey?
I think you said it. If you have the passion, take the risk. If you're doing
Mm.
it just to follow a herd or everyone else's,
Yeah,
or you think that's the
yeah,
easiest way to make money, please don't take that
yeah.
journey
That's true.
because there's no
Okay,
easy
makes sense.
entrepreneurship.
Yeah, yeah, amazing. Most of the oneness, I would say, members who will be watching this video, mostly they are the internationally educated healthcare professional. And as we're moving towards this new year, you can actually see that across the world, our parents keep on saying that Sayed, there is a surplus amount of labor shortage in healthcare. Okay, what's happening? Then they send another message saying that there is unemployment in Canada. Now, how would you tell this to the IHP? Telling that how does it actually work? They say there is a labor shortage, but people who come here with those experience and those education, they don't get the job as such. The same experience education give them PR, but after landing here, it doesn't work. And obviously because of regulatory license and everything. Now, how would you suggest for these individuals how they have to prioritize their life in this new country?
How do you prioritize? I would say
Yeah,
get your foot in the door.
yeah,
Once you have, see, here's the problem. It's very difficult to spend money when you're not having an income.
okay,
Especially
makes
for
sense. Yeah,
many of us, we have moved, we have left, some of us have left a thriving practice back home, wherever back home is,
yes,
to move
yeah,
here because we want to do it maybe for our kids or for whatever reason.
mm-hmm.
If that's your case, get your foot in the door, get started somewhere, but do it in healthcare. What you're going to learn is you're going to learn how the industry works. You're going to learn the pros and cons. Plus, you're going to get the experience,
Mm-hmm.
which in turn will help you when you're ready to apply for your accreditation exams, no matter what industry field. Like if you're a physician, a nurse, physiotherapist, whatever you are, it'll help you write that exam. That would be my first thing. Now, how do you, a lot of people are going to ask me is how do you get that first job? The only advice I can tell you, networking and networking.
Okay, you used really most commonly used terminology in this generation. No, networking is
Well,
going to actually help. Yeah.
I can tell you from my personal experience. I've been working 3 decades now. In last two
Mm.
decades, I haven't found a single job that I've physically applied to. Everything has been through networking. Somebody knew some opening, they recommended me, or it's all been through networking.
Okay,
And I
this is
can't
going to
ask,
be difficult for the newcomers to absorb what you are saying currently. Yeah. Okay,
like for
makes sense. Yeah.
newcomers, I always like I
Yeah.
teach a lot of students who are newcomers to the country, and I tell them, you forget how important things like LinkedIn are. Use them. Those are tools. Use them to your advantage.
Okay.
When you had your seminar, attend those seminars because they
Mm.
help with networking. There are people there that you can learn from.
Yeah.
There are people there who can open up, maybe if they don't know someone, if you really make an impression on them, if they don't have a job and they know of someone who has a job, they may refer you. You never know how it works.
Thank you. Thank you. Yeah, that's a good way to end our loads and loads of questions. Thank you so much. And the last question out of nowhere, it added in a way that's what people talk to me about, asking about this. Thank you for being so patient with me. And congratulations on your new endeavor you are starting right now, rebranding and everything. And I'm genuine that we spoke more about the personal story before. And I know for a fact that the passion you have towards actually adding value, actually improving the scope of practice, taking ownership in our skill. And that's what I always think about when I think about you. You don't just tell that there is a gap, you try to address those gaps. So God bless you. God bless your family. Thank you so much for joining in this podcast during your really busy schedule, doing so many things at the same time. Yeah, you have been doing this for past 3 decades. God bless you. Thank you.
Thank
Thank
you
you.